What to do if you have a heart attack alone? These measures can save your life. Have you ever wondered what you would do if you experienced a heart attack while completely alone? Would you know the critical steps to take when every second counts? Could you identify the warning signs before it's too late? Imagine this scenario. You're alone at home or at work. It's late at night. Everything is quiet, and it seems like just another ordinary day. Until a strange pain appears in your chest. At first you think, it must just be fatigue. But suddenly, the pain gets stronger. You begin to sweat, not ordinary sweat, but the kind that chills your body. The pain radiates to your left arm, to your neck, and shortness of breath begins to take over. Recognizing the symptoms and taking immediate action can make the difference between life and death during a heart attack. Would you know what to do in this critical moment? How would you call for help when every minute matters? Is that chest pain just anxiety, or is your heart actually in danger? Let's begin. 1. The 7 alarming signs of a heart attack that can save your life. If you've identified that you're having a heart attack, congratulations. Fewer than 5% of Americans can recognize the symptoms. It's worth revisiting the symptoms. There are 7 signs and symptoms that may indicate a heart attack. 7th sign: intense sweating and pallor. If you start sweating abnormally, that cold, clammy sweat that sticks to your clothes, and become pale, pay attention. This happens because the body releases adrenaline in response to the emergency, causing vasoconstriction. It's a warning that something serious is happening with your heart. 6th sign: nausea and vomiting. Gastric discomfort, feeling of nausea, or vomiting can be signs of a heart attack, especially in cases of diaphragmatic infarction. This happens because cardiac ischemia can irritate the vagus nerve, causing these symptoms. Heart attacks don't always follow the script you see in movies. They can disguise themselves as common ailments, especially in women and diabetics. Highlight for women. In women, nausea and vomiting are among the most common complaints during a heart attack. Unfortunately, these symptoms are frequently confused with viruses or stomach problems, delaying diagnosis. Special attention also for diabetics, because these may be the only symptoms, since chest pain may not appear due to nerve damage, neuropathy. Therefore, never ignore sudden nausea and vomiting, especially when accompanied by other signs or symptoms. Could that unexplained nausea actually be your heart sending desperate signals for help? 5th sign: dizziness or feeling of fainting. Dizziness can be caused by a drop in blood pressure, arrhythmias, or even the stress of the moment. In women, dizziness can also be a predominant symptom. If it comes accompanied by other signs, don't ignore it. 4th sign: numbness or heaviness in the arm. The pain, numbness, or heaviness can be in the left arm, but it can also occur in the right arm, hands, or even both elbows. The brain interprets signals from the heart as if they were from the arm, due to the connection between the nerves. 3rd sign: shortness of breath. Short breathing, difficulty breathing, or feeling of suffocation can happen with or without chest pain. This can be the result of the heart not pumping blood efficiently, causing fluid buildup in the lungs. 2nd sign: intense anxiety or sense of impending doom. Extreme anxiety, similar to a panic attack, can be caused by the discharge of adrenaline during the heart attack. Many people describe an imminent feeling that something terrible is about to happen. First symptom, the most frequent and important: chest pain. What is heart attack pain like? It's intense pain in the center of the chest. It can be a sensation of tightness, pressure, or crushing, as if an elephant were sitting on your chest. This pain can radiate to the arm, jaw, or back, and generally in the chest. So you've experienced these signs and symptoms, and you're alone. Many patients who survived heart attacks say they simply knew something very bad was happening at the time, that they needed urgent help. Why do so many people mistake these warning signs for something less serious until it's almost too late? 2. The urgent action that must be your absolute priority during a heart attack. What's the first step you need to take if you're experiencing this? A heart attack is a medical emergency. Time is crucial. Every second can make a difference. Therefore, the first step, and the most important, is to call someone who will take you to the hospital. This could be 911. Remember this number well. Or your health insurance ambulance service, your spouse, your child, your partner. I know that in some areas, ambulances don't arrive as quickly as they should. If you notice that the ambulance might take more than 15 minutes, remember that number. Call an Uber, a taxi, knock on your neighbor's door, so they can take you to the nearest hospital. The sooner you can get to the hospital and receive treatment, the greater your chances of survival will be. Every minute that passes increases the risk of permanent heart damage. The faster you can get to the hospital and receive care, the greater your chances of survival. Are you wondering if a ride-sharing app might be faster than waiting for emergency services during a heart attack? 3. The deadly trap. Why driving during a heart attack could be your last act. Now you might be thinking, if time is so important, wouldn't it be faster to get in my car and drive to the hospital? The answer is no, and I'll explain why. During a heart attack, your heart is suffering. A heart attack happens when blood flow to the heart is blocked, usually by a clot that forms on a plaque of fat accumulated in the wall of a coronary artery. This blockage prevents the heart muscle from receiving oxygen. Without oxygen, heart cells begin to die, and the longer without treatment, the greater the damage to the heart. It's as if the heart were trying to breathe through a pipe that suddenly becomes completely clogged. The muscle enters suffering, and depending on the affected area, this can lead to death in minutes. That's why time is crucial. 50% of heart attack deaths occur in the first hour. It's very common for the person to experience a sharp drop in blood pressure or even develop a serious cardiac arrhythmia. This can lead to a sudden loss of consciousness while you're driving. Imagine, you pass out at the wheel. You not only put your life at risk, but also the lives of others on the road. Not to mention that, even if you think you're well enough to drive, the effort of controlling the steering wheel, shifting gears, can worsen the ischemia, lack of oxygen to the heart. If you feel short of breath, dizziness, or worsening chest pain, you won't be able to react to these symptoms while at the wheel. That's why I always insist, ask someone to take you to the hospital, or wait for the ambulance. Have you considered the dangers that await you on the road when your heart is already in distress? 4. Crucial survival. Actions that minimize damage while help doesn't arrive. And of course, it's important that you ensure that first responders can help you quickly and effectively. Keep doors unlocked. If you have pets, put them in a closed room. This avoids complications when first responders arrive to attend to you. Have your list of medications and allergies at hand. That's why I always advise my patients to keep prescriptions on their phone or in an accessible place, like their wallet or purse. What to do while waiting for help? Stay calm and conserve energy. I know it's difficult to stay calm at such a critical moment, but panicking can worsen the situation. Try to breathe in a controlled, habitual manner, even with the pain or discomfort. This helps reduce the burden on the heart and conserves energy for the body. Sit or lie down in a comfortable position. Choose a position that helps relieve pressure on the heart. Sit with your back supported and your head slightly elevated. This facilitates blood circulation and prevents you from falling if you lose consciousness. During a heart attack, even simple activities can burden your struggling heart. Staying calm and still is one of the most important actions you can take while waiting for help. Avoid any physical exertion. Don't try to lift weights, move around a lot, or perform tasks. The goal is to spare your heart. Remember, each movement requires more effort from the cardiac muscle. What everyday habits might you need to immediately abandon during a heart attack to give yourself the best chance of survival? 5. Prepare the ground. How to facilitate the work of first responders and increase your chances. If possible, take aspirin. Regular aspirin, baby aspirin. If you don't have allergies or contraindications, chew 2 or 3 tablets of that 81 milligram aspirin. You heard right, chew. For the aspirin to work faster, Chew the tablet before swallowing, instead of taking it whole with water. Chewing accelerates the absorption of the medication into the bloodstream, providing a faster effect. Aspirin acts as an antiplatelet agent, meaning it helps prevent platelets from grouping together and increasing the clot. This can reduce the extent of the blockage and allow blood to continue flowing, even if partially, until you receive specialized medical care, reducing the impact of the heart attack. Of course, you won't buy aspirin at the pharmacy if you don't have it on hand. At the hospital, they will give it to you. Have you prepared your home with basic medications that could be the difference between life and death in an emergency? 6. The miracle pill you should have at home for cardiac emergencies. Does coughing work? You've probably heard that coughing vigorously can save your life during a heart attack. And it's time for me to demystify this idea. The so-called cough CPR is false information that has been circulating on the internet for a few years, but it has no medical or scientific basis. Remember what I said. A heart attack occurs when blood flow to the heart muscle is blocked, usually by a clot. At this stage, the heart is suffering, but it's still beating. This means you're conscious and don't need cardiopulmonary resuscitation. In English, CPR, which is only indicated when the heart stops completely. If you're conscious and can cough, then you're not in cardiac arrest. The idea behind this concept is that coughing repeatedly could generate a kind of thoracic compression and help the heart resume its normal rhythm. But this doesn't make any sense in a heart attack. The problem isn't the rhythm of the heart, as occurs in an arrhythmia or cardiac arrest, but rather the blockage in blood flow. Coughing won't unblock a clogged artery. You have isosorbide dinitrate, nitroglycerin, a vasodilator. You should take it. Avoid unnecessary self-medication. Aspirin is one thing, which really is part of heart attack treatment, but vasodilators don't reduce mortality. And if you've taken tadalafil, Cialis, or Viagra, you could die because of the vasodilator. Not to mention that in right ventricular infarctions, you can also kill the person if they take a vasodilator. So, no. Don't make things up. Could a piece of advice you found online actually make your situation worse instead of better during a cardiac emergency? 7. Invisible dangers. Heart attack myth that many still believe. And now, if you were called to help someone with suspected heart attack and found the person unconscious and without signs of breathing or movement, it's essential to act quickly. They may have had a fulminant heart attack. A fulminant heart attack is one of the most severe forms of acute myocardial infarction, characterized by its rapid evolution and high lethality. It occurs when a coronary artery, normally the trunk or the anterior descending artery, the main artery, suffers a complete and abrupt obstruction, leading to sudden cardiac arrest in minutes or hours. Take note, 15% of heart attacks manifest with sudden death, giving the patient no chance. Normally, massive coronary thrombosis caused fatal arrhythmia, ventricular fibrillation, or ventricular tachycardia. But what if you arrived at the moment this was happening? What to do? You'll have to call 911. Remember this number. They'll have the device, the defibrillator, that you'll need. But of course, you won't just stand still. When a heart stops completely, immediate chest compressions can keep blood flowing to the brain and vital organs until professional help arrives with a defibrillator. You'll perform cardiac massage, which are forceful compressions, about 100 to 120 per minute. You won't stop until 911 arrives with the defibrillator device. What would you do if you found someone unconscious from a heart attack? Would you know how to keep them alive until help arrives? 8. When seconds decide lives, how to help someone in cardiac arrest. The most important factor that determines how you'll fare after a heart attack is how quickly you recognize the symptoms and seek help. There is a direct relationship between the moment the heart attack begins, usually when the first symptoms appear, and the time doctors take to open the blocked coronary artery that's causing the problem. The faster doctors can unblock the artery and restore blood flow to the heart, the better the results will be. This not only significantly increases your chances of survival, but also reduces the risk of serious complications, such as heart failure and new hospitalizations. That's why you should always take symptoms seriously and never wait to see if it will pass. Recognizing the signs and acting quickly makes all the difference to save your life and preserve the health of your heart. And see the good news? In the last 2 decades, the United States has reduced heart attack mortality by over 25% on average. Some areas are even better than that. Why do so many heart attack victims wait crucial hours before seeking help, despite knowing the risks? 9. The race against the clock. Why every minute counts in heart attack treatment. And when you arrive at the hospital, defend your priority. If you think you're having a heart attack, you won't wait in line. Time is muscle. It's your muscle, it's your life. I attended to patients in emergency rooms for a long time, and I've seen people pale, feeling ill, holding their chest, waiting in the triage line. Of course I called them right away. Come here, let's do the ECG. And they were indeed having a heart attack. Don't wait in line. And if the doctor is dismissing your symptoms without doing an ECG, stand your ground. The minimum is ECG and enzymes. If you have an ST elevation myocardial infarction, which shows on the ECG, considered the most serious infarction, the doctor may opt for thrombolytics, which is an intravenous medication that will open your coronary artery, or even better, a catheterization and angioplasty with stent placement. How would you advocate for yourself in a busy emergency room when you suspect you're having a heart attack? 10. Defend your life. How to ensure priority care when arriving at the hospital. Who is more likely to have a heart attack? Risk factors for heart attacks. Men aged 45 or older and women aged 55 or older are at higher risk. Those who smoke. Those with high blood pressure and those with elevated cholesterol. Those with diabetes, obesity, sedentary lifestyle, very high stress, family history, use of illicit drugs such as cocaine. But there are people who have none of these and still suffer a heart attack. What hidden factors might be putting your heart at risk that standard medical tests won't reveal? 11. Risk profile. Who is in the crosshairs of heart attacks? How to protect yourself from a heart attack. Heart attacks can be prevented in most cases with proactive measures to improve heart health. By making healthier choices and addressing risk factors, you can significantly reduce your chances of suffering a heart attack. Adopt a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, while limiting trans fats, saturated fats, and added sugars. Practice regular exercise. Physical activity strengthens the heart, improves circulation, helps maintain healthy weight, reduces stress, and improves mood. How much to do? 75 minutes of vigorous exercise, such as running, per week, or 150 minutes of moderate exercise, such as walking or cycling, per week. The most powerful medicine for your heart isn't found in pills, but in the everyday choices you make about how to nourish and move your body. Maintain a moderate body weight. Avoid smoking. Prioritize sleep and manage stress. Treat underlying health conditions such as hypertension, diabetes, and high cholesterol, which can significantly increase the risk of heart attacks if left untreated. And get your regular checkup. Are you taking the necessary steps today to ensure your heart remains strong for decades to come? 12. Protective shield. Proven strategies to safeguard your heart. And now, I want you to take a deep breath and understand the information you just received can save lives, perhaps yours or someone close to you. Remember, recognizing the symptoms of a heart attack and acting quickly makes all the difference. This is what transforms an emergency into a story of overcoming. The heart is the engine of your body. Take care of it with affection. And spread this message. Share this information with your friends and family, because the more people who know how to act in a critical moment, the more lives can be saved. Every life saved from a heart attack represents someone who gets to see another sunrise, hug their loved ones again, and continue writing their life story. That someone could be you, or someone you care about deeply. This knowledge isn't just information, it's a lifeline. Keep it close, share it widely, and never underestimate its power to save lives. Remember, knowing what to do during a heart attack isn't just medical knowledge. It's one of the most powerful gifts you can give to yourself and those you love. Your heart beats for you every day of your life. Today, you've learned how to fight for it when it needs you most.